Hi, my name is Patricia Pittman. I'm the Executive Director of the Alliance for Ethical International Recruitment Practices. We're a nonprofit organization based in the United States, composed of 5 different sectors that are national organizations concerned about the ethical recruitment of health professionals. We include unions, the AFL-CIO, SCIU, and AFT. We have professional associations, including the American Nurse Association, the Association of Nurse Executives, and the Association of PTs, and the Association of Medical Lab Scientists. We also include recruiters and employer organizations, the American Hospital Association and the Federation of American Hospitals. Our organization functions with 5 sectors participating equally in the decision making. We are based on trying to promote a code of ethics that was jointly negotiated. The code has 3 parts that are based on the principles of respecting the rights of the migrant, the importance of clinical and cultural orientation for the migrants, which is essential to the quality of care provided to U.S. patients, and thirdly, the importance of having international recruitment benefit and not harm the sending country's health systems. We have both minimum standards in the code and aspirational goals. We are based on a model of certification. A certification is for both the recruitment companies and for the employers. They apply to come into adherence with the code, and in exchange for using our certification in their promotional materials, we monitor their adherence through surveys of the migrants that they're bringing over. So the essential strategy of this model is to connect the migrants with people who care about whether the recruitment that is happening is ethical and will act upon it. We believe that this is a strategy that is based in sort of rectifying the asymmetries in information between the migrants and the companies that they work with, helping to empower the migrants to make good choices, to be more informed about their rights, and to understand how the marketplace works, in this case in the United States. We are very excited to be here in the Philippines and to be working with a number of organizations, including PSLINK, the Philippine public agencies that are focused on this, as well as the Nurse Association. The Philippine Nurse Association of America has been very active in the alliance. It is founding. They care deeply about this issue. In fact, many of the problems that are experienced by the Filipino nurses who come to the United States were first discovered by the PNPA and brought to our attention by them. We are very excited to learn that there may be a coalition of organizations in the Philippines that are coming together to create a sister organization that would help monitor recruitment and advance the idea of certification of recruitment companies. And we look forward to learning more about what's happening. We believe that the situation has changed dramatically, in part because there's fewer nurses being recruited. Of course, there are more physical therapists. So the situation is continually changing. It's dynamic, but we believe that we'll be able to do more by sharing information across countries, and we welcome and are very excited about working with Filipino partners